Assalamu alaikum. Welcome to our channel, The Vet Couple Talks. Here we are with Dr. Abdul Manan, and I am Dr. Amna Shahid. And today we are going to perform tail docking surgery in this particular cow. The history presented was tail degloving at the tip of the tail, and it was because of some tail injury. Before starting any procedure, we ensure that proper analgesia and restraint has been given to the animal so that the animal relaxes and must not feel any pain at all. Then we proceeded towards epidural anesthesia. Following that, we had tourniquets on two points of the tail so that minimum amount of blood is lost. Then we are shaving and scrubbing and clipping the surgical site. So as much as asepsis that we can develop in field situation, we must do it. The point where the surgery has to be done is cautiously examined so that the function of the tail, like fly control and balance, remains. After shaving of that area, we will again wash it once and then we'll proceed towards the classic circular scrubbing of the tail. Here we are scrubbing it with povidone iodine solution. Here, let me tell you that application of the tourniquet is a very crucial step in tail docking procedures because the tail has very rich blood supply and uncontrolled hemorrhage can be dangerous. We proceeded with giving the classic V shaped incision and then we transected the tail vertebrae and we incise the muscles very carefully. Now here comes two type of ligation. One, you identify the blood vessels and you ligate them with absorbable suture. The next is that you apply heat cauterization or heat ligation, which we have done as per field conditions. Then we will proceed towards the same V-shaped suturing by applying simple interrupted suture. So we are taking the bites and suturing the tail. The animal is not even flinching, which describes proper anesthesia technique. Whenever you do tail docking surgeries, you must know the anatomical features of the tail of a bovine. As you know, the tail has coccygeal vertebrae, coccygeal muscles, nerves, two lateral and one medial caudal artery, and which is a very rich kind of blood supply. So your hemorrhage control must be very appropriate. The complications that can be happening if the surgical procedure is somehow compromised would be an infection, neuroma formation. Another point to focus is if the pain management is not appropriate, the animal will go into stress, and that stress would result in struggling and long term behavioral changes in the animal. The animal might reduce milk production and many stress symptoms. So, the pain management again is a very crucial and important step, not even only in this surgery, in any surgery at all. Here we are done with our sutures, so we are wrapping the tail with the steroid gauze completely to protect the tail from flies, infections, dust and dirt, and wet for being wet. This gauze or the band-aid must be changed alternatively so that it doesn't stick with the tail. Post-operative care includes NSAID, antibiotics, multivitamins, immunity boosters, and some hydration therapy as well.